resources. Many healthcare facilities had to ration masks and PPEs, for example, and that placed the healthcare workers and their patients uh, and compromised their safety. So, with respect to the economy had already been suffering profoundly prior to the COVID-19 pandemic. We had a huge shortage in foreign currency. The devaluation of the Lebanese pound was increasing, and the COVID-19 seemed to exacerbate the situation. Late June, early July, the devaluation reached its peak as to more than 10,000 Lebanese liras to the dollar. That led to multiple bankruptcies, failed businesses. Prior to COVID-19, we already had 700 closed institutions and 25,000 new unemployed individuals in Lebanon. So with the COVID, with the increasingly harsh socioeconomic conditions, many of these businesses had to close down. Unemployment rates skyrocketed. Many bank accounts were frozen. Transfers were prevented, and the socioeconomic conditions were harsher than ever. Similarly to the economy, the educational the educational sector in Lebanon was suffering as well. The civil unrest and the turmoil that was post the political uprisings made going to school inaccessible to many students. However, after COVID, particularly on February the 29th, the government ordered the closure of all learning institutions in order to adhere with the WHO recommendations and limit the spread of the disease by enforcing social distancing. So a movement towards online learning was implemented. However, with the infrastructure that we have in Lebanon, there were many limitations to that. So electrical energy supply was rationed more than ever. The internet services were slow due to the increased traffic, and the poor socioeconomic conditions rendered many families unable to provide the mobile devices required to cater for such online learning experiences. So the learning experience of many students were under jeopardy. Add to that the fact that many graduation ceremonies were halted. The fate of many examinations was a mystery. So many students were oblivious to their futures. They had the levels of anxiety and worry skyrocketed, and that will lead us to the next slide, which is the psychological well-being of the population. Many factors due to COVID exacerbated the psychological and mental welfare of the Lebanese population. We had the fear of acquiring the virus or spreading it to our loved ones. The Lebanese by themselves are particularly social people. So the disruption of social activities led to a disruption of their mental welfare. The socioeconomic conditions caused feelings of worry and anxiety to many breadwinners who were not able to provide for their families. And add to that the fear of being stigmatized by the disease and being shunned by the society for acquiring the disease. So if we go through this timeline quickly, so the first reported case was on February 21st. All educational establishments were closed down on the 29th. Restaurants and touristic attractions were closed down the week after. We had the first reported death on March 10th and the cured case the day after. A health emergency state was declared mid-March. Lebanese expats began arriving back on April the 5th, and leading us to June 11th, we had 1,432 confirmed cases. So what's happening now? As of around yesterday, we had around 280,000 cases and 2,320 deaths. That is a near 200-fold increase in cases from June in the span of 7 months only. So we believe multiple factors led to this phenomenon. When the virus hit Lebanon, there was the fear of the unknown. The virus was an imminent threat that just arrived to the country. As much more time passed, there was an increased nonchalance with respect to both the population and the government. And we saw that on New Year's Eve. The rules and the regulations started becoming less stringent. The people grew tired of lockdown restrictions. And add to that the fact that the harsh socioeconomic conditions placed many people under two options: Either they they chose to compromise their health for providing for their families and being able to work. And all this led to the exacerbation. However, we believe that one factor particularly aggravated the issue, and that is the Beirut blast. So the harrowing catastrophe occurred on August 4th. Billions of dollars worth of damage occurred. Half of the city was destroyed. Hundreds of deaths and thousands of injured people all occurred in the span of seconds. So if we zoom in and look at the number of daily cases for the past year, we can see that the rise started occurring gradually around August. If we look at the date of August 4 and check the positivity rate of the month prior, we can see that there is a steady increase in slope of 0.04 cases per 100 tests, which is gradually yet stable. In the month directly after the Beirut blast, that slope nearly more than tripled in frequency, and that difference was deemed significant. So why would the Beirut blast cause this? As we said, it was a major catastrophe. It caused destruction in multiple healthcare centers. As a matter of fact, one was completely out of function, and several other hospitals sustained millions of dollars worth of damage. So, in the face of the huge amount of people who were injured many of the other hospitals in the city had to overcrowd themselves in order to absorb the urgency of the situation. As a result, resources were shifted from prioritizing COVID-19 to prioritizing dealing with the injured personnel. In addition, the financial burden on the hospitals themselves due to the destruction further exacerbated the bad situation that we were already in. The aftermath of the Beirut blast included many protests and gatherings. Many did not adhere to social distancing and many did not prioritize COVID-19 regulations. And add to that the fact that many families were displaced, the socioeconomic conditions were worse than ever. All these factors contributed to the aggravation of the situation and may have caused a snowball effect that we are witnessing till this day. So we believe the Beirut blast is one of the major factors that have contributed to the bad situation that we are facing today. So to conclude, COVID-19 could not have come at a worse time for the Lebanese population. The pandemic had a multifaceted effect on the country with regards to public health, education, psychology, and economy. Multiple causes resulted in the situation that we are facing today. However, there is some hope in the end of the tunnel. Vaccinations are being spread worldwide. We have been patient for the past year. We can be patient for a couple of months until this situation is over. Hopefully, we can learn from the mistakes we have. We need to continue wearing masks, stay in our homes, abide by the restrictions and regulations, and hopefully this nightmare will end soon. So thank you, everyone.
Thank you very much, Dr. Faris, for your presentation. You put us face to face with our sad reality. It's very sad that this COVID-19 pandemic has come with all our, let's say, crisis that's around. So thank you very much. And please, if you can stay with us for the Q&A at the end of the session. Dr. Ahmad, I think now Dr. Zani's presentation is ready. So if you can share it, please.
Okay, just a moment, it will be on. Okay, Dr. Fatima, let's move on. We'll do it after this next one, okay? Because there's the audio thing, it will run with the video along with each other.
No problem. Okay, so our next speaker for today is Dr. Evelyn Hattie. Dr. Evelyn is with us. Just to check if Dr. Evelyn is ready.
Yes, I'm with you guys.
Hi, Dr. Evelyn. Very nice to hear from you today. So Dr. Evelyn is an associate professor in clinical emergency medicine at AUB. She graduated with an MD degree from Johns Hopkins School of Medicine in 2002, where she also completed her residency training in emergency medicine. After spending 4 years at MedStar Health and completing her MBA at Johns Hopkins Care Business School, Dr. Hatti joined AUB in 2009. She's currently the chairperson at the Department of Emergency Medicine and Deputy Chief Medical Officer at AUBMC. During her tenure at AUB, Dr. Hatti led the building up of the Department of Emergency Medicine. She took it from its infancy phase to a full-fledged academic department. And in recognition of her work and impact advancing Dr. Christina on acute care and management practices in low resource setting. And today she will be talking about the impact of COVID-19 on acute care and ED utilization in Lebanon. Dr. Hatti, we are very glad to have you on this webinar. Please, yes, you shared your presentation.
Yeah. This is actually Dr. Zan's presentation. I'm trying to, let me just share my screen.
Okay.
Go ahead, please.
Yes, go ahead, please.
Yes, yeah. There is a technical issue that I'm having as well with sharing screen. Hang on.
It happens. It's okay.
No problem. Just take your time. Just do the sharing of the screen.
Okay. So my browser is actually preventing me. ما بدي أضيع وقت لأنه I know we're already 20 minutes into this. So I can
Okay,
just
so
basically
you can.
we can go.
It's not allowing you to share, or what is it doing?
No, it's not allowing me to share, and it may take some time, but I can go through it. Yeah, and it's basically we don't need the slides. So if it's okay with you guys, we can just I can talk about our study without the slides.
No problem.
So what I'm going to present is basically talk about a study that we did that looked at ED utilization during the first 3 months of the COVID outbreak in Lebanon. So we looked at how were patients coming to the ED, how were they accessing care, what was the impact of the first 3 months of containment on ED visit utilization during the first 3 months from February 21st, 3 months onwards. And the reason we were interested in that is, of course, the global data on access to ED visits was emerging, and we were hearing that fewer patients were presenting for acute coronary symptoms, for MIs, for strokes, to hospitals and emergency departments. And while you expect that many diseases and utilization would drop for less urgent things, ankle sprains, colds, sore throats, those are things that were really a surprise to people. Why would acute coronary syndrome, why would strokes, why would we see these drops in non-communicable diseases? The JAMA article emerged last year in 2020 that looked at active deaths in the US related to COVID.